as you know, patients that are searching for, I don't like my smile, and they're out there trying to find how do I get that, you know. They may not know what it is about their smile that's causing their smile not to look good. And so that's a very helpful thing. I'll have the patient sit with me and I'll just say, you know, tell me what you don't like about your smile. And we'll look at those things, and then I'll probably have a reason why their smile is that way. Sometimes the teeth are out of position. Maybe it's because they have some old silver fillings in there that are bringing a shadow through the tooth, making it look gray or dark. You know, so it may not just be I need to lighten my teeth or bleach them, but there are the other things. My job is to figure out how can I give that smile in the least costly and least invasive way. That's what I feel a good dentist should be doing, is I want to do the least amount of dentistry to accomplish what we need to do to get that smile. So what I'll do is I'll do a real thorough exam, we'll take a look at things, then I'll sit, you know, usually that first appointment is just me gathering information, photos, what patients' you know, needs are as far as what they think is wrong with their smile, or what they're hoping to accomplish. And then I'll sit back and I'll study that, and I'll determine, okay, I think the best way to approach this is this. Okay, sometimes that may mean orthodontics or something else, and then if that patient says, well, I really don't want to do braces, what else is there? You know, that might be the most conservative and least costly way. Then we start talking about other options too. And once we kind of figure out together what the path is that they want to take towards that great smile, then we figure out, okay, well, this is what it's going to cost. And before we ever get going on anything, that patient's going to know right away what they're going to be dealing with, what their investment is to get that great smile. And then we also go over these financial options that they have available and what will work for them. It's not necessarily free, because I think what I would want, I always try to do golden rule dentistry, you know, the kind of dentistry I would want to have done for me or a loved one. And what that means is I would not want to just go into office and have somebody look at me and say, yeah, we'll just do this, you know, without really studying what's going on in there. I would want to know whether or not I have any cavities. I'd want to know, is there any problems with any teeth that might create some complications in our dentistry that might mean that we have other treatment we need to do that tooth to have it even be in a position to be able to have cosmetic dentistry done. You know, I would want, to know those things. I would want to know whether the gum and the bone support is stable enough to make this kind of investment. You know, what if you have a bunch of loose teeth? There's gum disease. Doesn't matter how beautiful we make them if they're going to be lost to gum disease. So I think what's best for patients is to have a comprehensive look at what their health status is, be sure that their mouth is healthy enough for cosmetic dentistry, then we sit together and talk about what that is. As far as the consultation, I mean, they'll pay for whatever x-rays and the exam, but that consultation where we sit down and go over all of those things, and sometimes I spend anywhere from 3 to 6 hours outside of the time with the patient, or, you know, getting things together for them, or several consultations with the patient. Those aren't charged. You know, once they do the exam, we have a no-charge visit back just to review everything and come up with a plan together that works for that patient.